the agenda. We have a little introduction. Which horses get stomach ulcers? Why are horses prone to ulcers, stomach ulcers? Let's look at the risk factors. How do we treat them? And probably more importantly, how can we prevent them? So there are two main types of stomach ulcers: damage to the equine stomach lining due to excessive stomach acid, or problems with the natural protection of the stomach lining. It can be serious health problems in foals and adult horses, but foals can actually die from ulcers. So how common are these ulcers? Do we need to worry? 93% of racehorses in training have some form of stomach ulcer.
Apart from nobody this morning.
Exactly what we did this morning. That's like 7% now. Always away. Okay. 60% of other performance horses have ulcers. More than 50% of foals have been shown to have stomach ulcers. Donkeys, there's still quite a lot of research to be done on donkeys. The Donkey Sanctuary found that 50% of the donkeys they scoped had stomach ulcers. And what about pleasure horses? I would imagine a lot of you have horses in that category. How common are ulcers with those? Well, this was research carried out by Dr. Tim Brazil, and this was 50 pleasure or lower level performance horses that were presented with suspected clinical signs. And they were graded, and 66% had significant stomach ulcers. We were looking at this grading scheme a bit later on in a few slides on. So it affects a huge amount of horses. Why are horses prone to stomach ulcers? Sorry, that hasn't come out very clearly there. So horse's stomach. That hopefully won't put you off your lunch there. We need to look at the stomach to see how these ulcers affect. These are trickle feeders. We all know that from our pony club rules. Trickle feeders. And they continuously secrete gastric acid throughout the day and night, unlike you and I. We secrete it when sort of meal around lunchtime. They secrete it all the time. They do not need food there to secrete this acid. Adult horses can secrete 1.5 litres per hour, which if you think of the size of a Coke bottle, that's a lot of acid. This is the stomach. Some of you saw the horses being scoped this morning? Yeah, okay. So the scope comes in through here, has a look around the top part, the squamous, and then down through the bottom part, and hopefully out through here. Now, Mike makes it look very easy, but it is much harder.
I did lucky run this morning.
You're probably very good on computer games, are you?
I'm actually rubbish.
It's way cross,
Exactly.
We can get ulcers in the top part and the bottom part, and the squamous mucosa part and the glandular mucosa part. The squamous mucosa, which is the top part, is non-glandular. It's a bit like a holding bay for food there. So there's no glands, no secretory or absorption function, and it has no protection there. They say it's the most common location for gastric ulcers. It might also be that it's easier to look at them there. It's harder to look in the bottom part of the stomach. And then the bottom part is glandular mucosa, so that's 2/3 the equine stomach. It's more like our stomach, this part is. It contains secreting cells, the hydrochloric acid, and it has the mucus barrier to protect the stomach from the acid. The acid in there is so acidic, it's a bit like your Mr. Muscle drain blocker. If I poured some on this carpet here, it would burn a hole in it. And we grade these ulcers from grade 0 all the way to grade 4. What we'd like is a horse's stomach to have grade 0, maybe a 1, but we can see them all the way up to 4. I think this morning we've had a grade 3.
Yep.
Okay, so this is what we want. I think it'll come out that clearly, sorry about this. This is what we want. The top part, a nice creamy pale colour, and then the bottom part, a nice pink healthy colour. That's better, yeah, thank you.
No problem.
Okay, but often what we find is this is grade 3 and grade 4. I mean, that looks sore, doesn't it? Oh, it's a squeaky door. Any more? ulcer this morning. And the glandular, you can see again, these are very sore, and these actually take much longer to heal. Do you want to try that, Mike?
Yeah.
Mike, what if you put that coat over the top right now?
I'll try.
Mike, do you want me to start?
You're right there.
What to do with the
I'm
hair
not
tie?
used to sunny, sunny weather.
Nice, actually.
I used to know what to do with a hair tie.
Yeah.
Can I just ask what a glandular lesion is?
Then the lower part of the stomach.
In the lower part?
Yeah.
See, you might work go back to your anatomy picture, because that will be easy for you to explain.
So here we are. This is the top part, the squamous part. Okay, and then the glandular ones are down here. So this is more like our stomach, this part. This is more a holding bay. And this should have a protective barrier, because this is where all the acid is.
Yeah, thanks.
You happy with that? Yeah. Yes. So this is what we'd like to see, the top part and the bottom part there with the two different colours, but unfortunately this is sometimes what we do see. Okay, so gastric ulcer in the squamous region. Oh, am I right to carry on with that?
Yeah, fine. Please do.
Gastric ulcers in the squamous region, the top part, most common site. There's no protective barrier there. Okay, so basically any exposure to the acid will cause problems and can cause ulcers that way. So you can have things like the washing machine effect. So if you're doing a lot of exercise, the acid from the bottom can come up and splash the top, and therefore can cause ulcers that way. Gastric ulcers in the glandular region, less common, or maybe we just don't look as much down there. There should be the protective barrier to protect against the acid, but often it occurs due to disruption of this protective layer, and it normally takes longer for the ulcers to heal in the lower part of the stomach. So what are the risk factors? Intermittent feeding, the diet, exercise, stress and medication. So all the things we do with our horses. Intermittent feeding. Acidity in the equine stomach is greatest in the absence of food. Food neutralises most of the acid, and saliva neutralises acid. So if denied food, ulcers can begin to develop within 48 hours. If you think of a horse in its natural environment, it will be eating grass continuously. If you think of the horses we have stabled, we regularly feed them 5:30 with their evening meal, and hay net. You'll probably finish that by 9 o'clock, and we might not be back down to do them in the morning till 7:30 in the morning. It can be a long time when they don't have any food. This was research carried out by Murray in the 1990s, and what we did is put a probe in there to see how acidic the stomach was over a 24-hour period. And it's roughly 4, pH of 4. And this is extremely low. Roughly 4. And that's when the horse was given free access to hay.
The lower the number, the more acidic it is, just to clarify.
And they carried out exactly the same experiment, but they took the food away. Huge difference.
Is that completely depriving it too?
Yeah.
Is that what we've done 12 horses in the last 24 hours?
Yeah.
Thanks.
Well, some of them.
Mine just did better weekend.
So you can see within 24 hours, that's a huge difference there. This was also research carried out by Murray, and this was gastric acidity is high in empty stomachs. But what they did is gave the horse food, then removed the food for 24 hours, then gave it ad lib food, and I'm talking hay here, and then for 24 hours, then removed it again for 24 hours, and did that. And as you can see, day 0, lovely healthy stomach. 48 hours later, got ulcers there, and by 96 hours, awful, grade 4.
Is that just from giving them, doing the alter, like not being consistent in what you're doing?
Yeah, so 24
Proving
hours
that
they
starting
had
with what
free
caused the
ad lib
problems.
hay, then then that was removed 24 hours, and then
So how do you come across horses that have laminitis when obviously you cannot give them ad-lib food? So how do you go, I mean, how do you overcome that?
extremely difficult, and I think that's one of the hardest things to actually do. And if you think about the horses that are in the wild, when they are, you know, they can be grazing for sort of 16, 20 hours a day, the quality of the fibre that they're eating in those conditions is so poor that they're getting a lot of roughage. And I think that's one of the key things that, you know, we've got to look at now.
So they'd be
What
better
you're
off,
feeding.
they're better off than really on bad pasture grazing all the time rather than being stuck in a stable
Better
and
than
starved.
they-
Not much bad enough.
Yeah, well, yeah.
But also, like, what we try and do with soaking their hay is try to
Wash out.
maximise the amount of fibre that you can feed whilst minimising the sugar that they intake. So, you
So
know,
would
lots
you
of
not
little
best
hay
on
nets.
straw though?
Yeah.
Are they not best eating oat straw or something
Yeah.
like that?
I think that's fine, you can integrate
Because
that as
that's
well.
kind of more roughage than
Yeah.
anything
Do you think
else.
that could be why it's more prevalent now? 'Cause I mean, they weren't used to use shavings or anything like that years ago. Or perhaps they didn't know about them.
I'm looking at it
Who
more
knows?
now.
But
Yeah,
it's,
it's
at
probably-
least they can just keep eating.
Yeah,
I
exactly.
mean, I think for their sanity, it's good to have them on straw, so they can just
I'm sure.
don't get so
I did
bored.
last night.
Save some food as well.
Save some food.
Question about this.
Doesn't save our vet space.
Yeah, but they get colic.
Yeah, action.
Withdrawing, having food, then withdrawing food, and having food and withdrawing it, that it does not affect, in that experiment, the glandular part of the stomach. It only affected the squamous part of it.
In this one, yes, it does seem to only
And is that
affect
the general theory?
No, I think the theory is we're still looking. It's quite a good question. It's a very good question. That we looked at them all before, and they were much more put together. The two ulcers, you know, with the glandular and the squamous, were much more together. I think now, and Andy Darren Lipwood is doing research on it, and Richard Hepburn is doing research on it, is that the lower part of the stomach, they think the ulcers that down there, there's different factors, and they are looking at it a lot more, things like helicobacter and things like that. They're looking at it a lot more, and I think, I mean, one theory is they even start giving them a different name for the ulcers in the lower part.
So they're almost like operating on two different levels, the two parts of the stomach.
There's
Yeah.
And
definitely
different
two.
things affect the different parts of the stomach.
Yeah.
There's
One
definitely
is
two
that-
very different etiologies, because that top part of the stomach is not designed to be in contact with acid particularly, and so the idea is if you've got a full stomach with a big mat of hay on the top of it, then that's going to stop
Yeah.
any of the acid that you produce from splashing up and covering that area. As soon as you take that away, then you've got very acidic liquid which is free to splash up in that area. Whereas the glandular stomach, so everything below that line, that's designed to be in contact with acid all the time. And so although the acid's job is to break things down and digest things, the idea is that evolution has produced something that can stop that from happening. So you've got a thick mucus layer which protects that region of things. Then when we have a problem is when, for whatever reason, the mucus layer and the protection of the lower part of the stomach gets disrupted. Then once you've got acid exposed to that area, it becomes very painful because it's constantly exposed, and it's difficult for that to heal. And what Caesar was alluding to is that one of the reasons we think this might happen is that there could be, like in humans, a bacterial component. So you get a helicobacter infection which causes disruption damage to the layer, and then it just gets in there. So now a standard, if I get a glandular lesion, like open the pylorus, then we tend to start, from the start, just treat them with antibiotics as well as Gastrigard, because what I used to do is treat them with Gastrigard, plus or minus antepsinamine, and then we'd look at them again in 4 to 6 weeks, and almost always they'd still be there. Partly because we go, they take a long time to heal, and then we go, right, well, this might be a bacterial infection, there's no one's done any research or any evidence to prove it, but that's what our thoughts are, put it on antibiotics, and then they seem to heal better. So now I've just started putting it on there as standard at the start for the plant pylorus.
Well, that's sort of done at 360, hasn't it? You know, first of all, it was considered, you know, to be there and worth going on to the antibiotics. Then it was no, and now more research is now backing it up again. So it's, you know, we're still learning more about this.
So can I just ask, the splashing that occurs, so say for example, the scenario you gave, 5:30 feed, pain it lasts at 9 o'clock, and the horses are hopefully quite sedentary, quite settled in their stables. Is the splashing more minimal in that environment than say if we take them out, don't give them a hay net and work them? Does the splashing become...
There's different factors. If I move on to that, that's a really good question. So if I move on to that, okay, so I think I'm answering that question.
Oh, sorry.
If that's all right. You know, it's a really good question, but I think I'll cover that in a minute. Is that all right?
Yeah, that's fine, thank you.
Okay, so we looked at that experience. You were happy with that one? Yeah. And then we move on to foals. Foals, we're obviously got to be very worried about foals because they can die from ulcers. So if you are breeding, you do have foals. Milk obviously has a very good buffering effect. So you need to keep an eye on your mare, as you would anyway, to check that the foal is nursing well. You don't have full bags. So hopefully this will help. High roughage diet stimulates secretion of bicarbonate-rich saliva. So the more they're chewing, the more saliva they produce, which has a great buffering effect as well. Okay. Whereas if they're on a high grain diet, they're going to be chewing less and so producing less saliva. So if you give them a kilo of hay and a kilo of coarse mix, they're going to finish the coarse mix in no time and produce a lot less saliva than they will with a kilo of hay, for example. Okay, so that has one effect. You want them to produce saliva. Oh, yeah. You want them to be chewing and produce saliva, but also high grain diets stimulate gastrin. Right.
Yeah, I'm fine, thank you.
Yeah, which, produces more acid as well. So higher grain diets, we're going to have problems with more acid as well. So if you think of your racehorse, a typical racehorse has very low fibre diet and very high grain diets. So you're having a double effect there. Is that right?
Yes, thank you.
So feeding with performance horses may be confined for long periods of time, less likely to be grazing continuously, fed large concentrated meals, and also the classic fasted before exercise. We always did that. You remove your hay net before you do any especially fast work, etc. Whereas, as Mike's already said, you want it's a bit like the coconut matting on the top of the stomach acid to stop it splashing up to the top. So some say, for example, hay before they exercise is a good thing. And then looking at exercise. So high-speed exercise increases pressure in the stomach, and high-speed exercise decreases the acidity. So if you think about it, if you've got an empty stomach and the horse is going fast, you're going to get this, what I class as the washing machine effect, with the acid splashing up on the top. So prevalence of gastric ulcers in horses actively training. When we say training, we're talking about racehorses again here. 93% of all horses in training have ulcers, but 100% had ulcers if they've raced within the last 2 months. Except for one this morning.
I hadn't raced in the last 2 months.
Oh right, that's right. So training, you can see here on March 25th, the horse had ulcers, and by June 3rd, it's got grade 4 ulcers. Medication, long-term use of non-steroidals may cause ulceration of the glandular region. Still research being done on this, and I don't want you all going home worried because your horse has been on a sachet of bute for the last few months. You know, we are talking when they're on higher levels of, say, drugs than that they're supposed to be used at. We did hear of a story of a polo groom down in Sussex, this was, who misunderstood what the vet had said and had all the bute in about 3 days when it was supposed to be something like 3 months worth of bute. So, more concerns and things like that. Stress. Foals with concurrent illnesses are prone to gastric ulcers. Hospitalisation, transportation and relocation. These are all forms of stress which can lead to ulcers. So again, this is research carried out by Murray. All the horses on pasture, they were scoped, and then they had 7 days of being in the stable, having free ad lib hay, but they did Not all of them, but a lot of them did get ulcers within 7 days, and that's literally a management change there. This is actually looking at transportation. I mean, we all travel our horses. And, 2 groups of 10 horses. Group 1, normal management regime, carried on as normal. Group 2, the only difference was that horses were transported to a different site for training on day 0 and on day 4 for 4 hours of travelling. The ulcer scores were determined on day 0 and day 5. And 2 horses in the first group had mild ulceration, but 7 horses in the second group had ulcers. So you can see just small changes.
Did you scope them before?
Yes. On day 0 and day 5.
And this is all in the upper part of the stomach.
Yeah, useful again. Yeah.
So, do they all have 0 on group on
Yeah.
day 0?
Yeah. So what are the clinical signs? Poor appetite, poor body condition, decrease in performance, maybe attitude changes. We had one this morning, I believe, that was happy, happy horse, and then not happy hacking out and being a change in its attitude with its work. Mild to moderate colic. In foals, this is a picture of a foal. This is textbook of a foal with stomach ulcers. I don't think we've ever come across a foal like that. That's what the textbook is saying. Okay. They can grind their teeth, produce a lot of saliva, have a lot of saliva coming out, diarrhea. So sometimes people worry, think of foal heat when it can be ulcers. Have you ever seen a foal with ulcers up and down like that?
I've seen one that lay on its back like that.
Have you?
But,
Usually
Okay.
it's grinding really and just
So, do the ulcers fluctuate? So they could potentially be of a grade 1, and then after a few days of whatever they've gone up to a grade 2. Would they then go back down to a grade 1 if you were putting loads of fibre into the diet, or is it the likelihood is it's going to stay at that level, or will it fluctuate?
I think the thing is that it varies with different horses.
Right.
Because, say for example, event horses, some of them can be turned away. They can have ulcers and then to be turned away for the winter and brought back in. And some of them won't have ulcers, they're cleared up,
Yeah.
and some still have the ulcers. So I think it does depend on the individual horse. Would you agree with that?
yeah.
So if you were to scope things like the New Forest pens that are permanently out wild, would they presumably not have ulcers or?
Well, this is the thing. That's a very good question. In theory, they're very low on the risk. So we've got a website that you can go on to look at the risks and see how at risk your horses are. And if you did a tick box, you'd say they'd be extremely low. But there was a horse. I was at a scoping clinic down in Dorset about a month ago. We had a 2-year-old New Forester come in. Wasn't in work. It was out 24/7. It wasn't on any hard feed or anything. It did look a bit poor, only a little bit, but it was prone to the smaller colic, not very mild sort of colic, and they scoped it just because they couldn't really put their finger on this mild colic, and it had grade 4 bleeding ulcers.
My God.
But
Was that one that was wild though on the?
No, that
okay,
was-
but I meant like the wild ones. If you was to capture one of those and then scope, like say you caught 10 and scope those, are you likely to or not likely to? Because obviously they're eating grass 24/7. They're not on feed. They're not on hay.
I reckon if you pull them off the hill and stick them in a box
They
for
get stressed.
12
So-
hours
Yeah.
to be able to image
Yeah.
them.
Then
they
they
really
really
don't.
doesn't. Then on that case, you would never really know the truth of it, would you? Because by starving them causes the ulcers. By not starving, you can't see if there are any. So you can't really get a true story of it.
It is a difficult one. In theory, the New Forest ponies shouldn't have ulcers, but
In theory, but you don't know.
no.
I think it's you can certainly compare horses that do nothing and horses that have management changes and are used and transported, and that does, as Caesar showed, increase the risk. But no, you don't know necessarily what baseline is.
So presumably then for all this, it's all FBI. I mean, you could obviously use it for FBI competitions and everything, can you?
That's right, yeah.
Yeah.
But not under racing. Yeah, I'll come on to that actually.
So if you can't use it for racing then, so what do they use? I mean, that's really harsh, isn't it? But then so for the 3 days they have to suffer ulcers. By the time they get to the race course, they're so
Then have
full of
them back
ulcers.
again.
Yeah. God, that's terrible.
So how can ulcers be diagnosed? Well, I think we all saw that this morning or seeing it this afternoon. Difficult to diagnose. You know, the clinical signs are subtle. The only way you can diagnose it is with the endoscope. And here at Towcester, you are lucky that they have invested in a 3-metre endoscope. There's a lot of equine practices that don't have an endoscope. So I think hats off to Towcester for investing. Treatment. Aims of treatment: eliminate the clinical signs, promote an environment in which the ulcers are able to heal, also prevent ulcers from reoccurring. So there's the management, medical management, and also the lifestyle management changes. Medical management, things like antacids. Obviously, we have things like Rennies, which when I was heavily pregnant, I ate by the bucket load. It's more difficult with horses because they're not like us, they're producing acid all the time. So you'd have to give acid, you're going a lot to the horses. With horses, there's a proton pump inhibitor, which is Gastric the company that I work for manufacture. And it's the only medical management licensed for horses. I'm not sure if anyone here has used Losec, but that would be the humour version. Suppressor of gastric acid secretion. It blocks the pump so that it stops the acid pump production, and then the ulcers can heal. It's available in an oral syringe, like your worms, and it's once daily dosing. Promotes ulcer healing, 99% improvement within 87%, healed within 4 weeks. Allows complete ulcer healing whilst the horse remains in training, and it's a very safe drug.
Sorry, can I just ask, so if they need the medication, do they have to be on that constantly for the rest of the lot? You fluctuate it?
No, normally we say, it depends on the individual case, and you'd have to talk to your vet about the individual case, but normally we say a 4-week dose. You may be able to change management, and then whether you need to reduce it down to maintenance level. Some horses do need to be on it at maintenance level.
Right, okay.
Some you can change the management. It also depends where the ulcers are. We've already talked about the glandular ones do tend to take longer to heal. But it does do it, and that's one of the key things actually. A lot of owners have their horses scoped, and then they use the drug. They don't follow up with a root scope, which we really recommend that you follow up with a root scope to see, how the stomach is healing.
So potentially you could be on maintenance level of the drug. So that is
Potentially.
The other thing is, if you're saying that horses, obviously, which you've proven, competition horses suffer at change environment, should they not always be on it? Because obviously, for instance, like Charlotte with her dressage horses, she's competing, going to different places.
Flying.
So her horses, flying, but in her horses in that case are always going to be susceptible to possible stomach ulcers. So how do you know when to put them on and when not to put them on it? Because if they're susceptible within 24 hours of getting it, how do you defend it?
If you suspect your horse has ulcers, then and it is scoped, then you can work with your vet for that individual horse. So some horses, we know, are very susceptible to ulcers. So if they're going through a period of stress, travelling abroad, whatever, then their vet would recommend them on a maintenance level. Some horses seem to heal, they heal well, change the management, and the horses just don't seem so susceptible. So when it comes to individual horses, you really need to talk to your vet about that individual horse. Horses with ulcers. This is just some of the cases. Sorry, I don't know how to do the time actually. Sorry.
5 minutes.
I'll be really quick then. just a few of the case studies that we've had. A complete monster. Mare suddenly became extremely difficult to handle and ride. Non-stop flocking. The horse never gave in. Several stressful hormonal problems. Coat deteriorated. They scoped it and it had grade 4 ulcers. So very severe ulcers. It was treated with Metrazole for 4 weeks, rested from work and turned out to pasture. Very quickly became much easier to handle, made her tail improve, and she started to look much better. She's now better than she's ever been. That's one example.
So is there any research to say whether mares, stallions or geldings are more susceptible than...
There's no research on that.
Right.
No.
Is there a thought on perhaps stallions might be more susceptible than mares, do you think?
Possibly stallions because they're managed in a completely different way.
Right.
Because of the nature of the beast, a lot of those are in a box for 23 hours a day.
But our knowledge of cases is skewed by the type the scope, i.e. there's more geldings that are in racing and are ridden in performance horses, so therefore they tend to be more you partly driven by what you look for, if that's something the ones you look at. There isn't really a particular, we don't see a preference between geldings or mares particularly. There's no
This is quite interesting because obviously, if you think about some mares, I mean, we've got an our yard, a classic chestnut mare, and we always write off her behaviours that sometimes actually, from what you said here, could be gastric ulcer symptoms to her being a chestnut mare. So I was just wondering.
We don't even colours. And
The
the
thing
chestnut
about-
mare.
You know, I don't want to scare you all thinking all horses have ulcers, but the real good thing with a practice like Towcester, where they've got an endoscope, if you are worried, you can have it scoped.
Yeah.
And it is very much, they've got them or they haven't,
Right.
which, you know, you can then treat, or, you know,
If they didn't have them, they wouldn't tell me come here.
you know.
The next day.
Yeah, so the next day.
This is an 8-year-old advanced eventer, had been on omeprazole during the summer as condition of performance was poor and weight had been an issue. Not scoped at the time, but improved. Then it was out of pasture for 6 months due to high lameness. It was scoped and revealed to have grade 4 ulcers throughout the stomach. So it was advised to be on omeprazole for 28 days, then on a preventative dose. So that was turned out, still had it. Bucking broncho, cold-backed. Bucking broncho exploded when leg applied. Crib biting, bouts of colic, looked awful, poor doer. Again, it had grade 4, treated with omeprazole with more access to roughage and pasture, and they said it was virtually a different horse. But they said the company's character had changed. This one was extremely thin, aggressive, striking out. When it was scoped, had grade 3, 4 ulcers, treated with omeprazole and qualified for Hoy's 2004. It's now on low dose of omeprazole when he's competing, etc. This was 3 thoroughbreds from the same owner on a national hunt yard. Horse 1 was 6-year-old, no clinical signs, on holiday, out of pasture, had no ulcers. Horse 2 was a 6-year-old, no clinical signs, in light training, had grade 2 ulcers throughout the stomach. And horse number 3, a 7-year-old in full training, good appetite, won twice last season, but didn't seem right this season, and that one had grade 4 ulcers. That's sort of textbook, that is. And even ponies can get it. An 8-year-old wild section C jumping pony at pasture for 4 hours a day. It was overweight, so they were obviously concerned about its diet. No history of ulcers, but really naughty in the stable and under saddle. Naughty jumping in the winter. Cribber and Winsut. And it had a few bouts of colic and was quite lethargic. It had grade 2, 3 ulcers in the roof of its stomach. Treated, and the behaviour turned around straight away.
Do you find, is there an association between components of the ulcers and things like cribbing and windsucking? Do you
Yes.
find that is more, the windsucking is more of a symptom perhaps of the ulcers, or the other way around, horses that are more cribblers tend to have?
What they feel is if they're youngsters and they start doing it, then you often find that a horse has ulcers, but if they have done it for a long time, then by then, yeah. Prevention, I've got no time whatsoever now. Sorry.
Talk about prevention, it's fun.
Prevention, reduce the risk of ulcers through management. So environment, turn the horses out to pasture as much as possible. A mirror has been shown to help as well, interestingly. Feeding practice, regular feeding, the less a horse has an empty stomach, the better. Have hay available at all times while the horse is in the stable. You know, 2 or 3 nets maybe just around the stable, even double net them. Alfalfa hay can help buffer the stomach. It's high in calcium, but also it's short chopped. If you have the short chopped, like your alfalfa array, dengue, they have to chew that more, the short chopped fibre as well, I'm interested in. And limit your grain rations. Exercise, don't train on an empty stomach. Think of that, a little bit of a coconut matting on the top there. Consider your exercise regime. And then obviously medication with omeprazole then. So sorry.
It's fine, don't worry.
Gastric ulcers are a major health problem affecting foals and horses. Clinical symptoms are subtle and non-specific, and I think that's the real key thing there. Recognising symptoms key to ensuring early treatment, but if your horse does have ulcers, they can be treated. So you don't need to panic.
Well, I think if there's any